Thank you all for taking time to listen to our presentation today, and especially to ZeOmega for inviting us here to present to you. What I'm going to take you through is our company background and a little bit about our company, some of the technologies that we have to offer, and then the last half of the presentation will be a live demo of our products. So you'll actually see how the patient uses our technology to stay connected to their care team. So Vivify was founded back in 2009 by Eric Rock. He's our CEO and founder, and this is actually his third company. So Vivify is a remote care platform that connects patients to their care team, where it's a cloud-based application. And Eric has, I say he's a serial entrepreneur. As I mentioned, this is his third company. His first two companies weren't even in health. The first company wasn't in healthcare. It was called ProHost, and ProHost was the first touchscreen table management system used in restaurants. He developed that back in the early 90s, and it was later acquired by OpenTable. I don't know if you guys are familiar with OpenTable, but it's an online reservation system that was acquired back in 2000. Towards the middle of the 1990s, then, the next logical space for Eric to jump into, he thought, was healthcare. So he went from the restaurant industry to the healthcare industry and developed the leading emergency department EMR that's out throughout the United States today, called MedHost. So when you think of the differences between the similarities between the restaurant industry and the emergency department is you have episodic care being performed. So patrons come into a restaurant at certain times of the day. Patients come into the emergency department at certain times of the day. You have a dedicated team that takes care of those patrons or patients. And so he was able to successfully build a very robust EMR for the emergency department. Then in about 7 years ago, he decided to move beyond the emergency department system and develop another system called Vivify, which is what we'll be talking about today. And again, it's creating that user experience where it's very simple for the end users to use and collect the information that you need to make decisions on, as well as pass on information back to the patients. So early on, we were white labeled by AT&T. We have a relationship with AT&T and Ericsson. So Ericsson is the largest network provider across the world. Basically, 60% of network providers are housed by Ericsson. So if you hear AT&T selling, promoting remote care, it's actually our solution. We had some very nice early investors in our Series A that afforded us the luxury of getting in with large healthcare systems. So our first toe in the water was really with large healthcare systems that helped move us in a quick direction to really deploy our product across the United States. We are now getting into other types of organizations that provide care, whether that's through the payers or through organizations that are kind of the middleman between a payer and a provider that provide remote services. Here's just a sampling of some of the brands that are currently our customers. So you can see large healthcare systems, but also that cover adult and the pediatric population. What we're going to talk about are two products today. One is our Managed Kit, which is our product that is basically housed in a nice managed suitcase-like box, and in that box would be the technology and the devices that are appropriate for that patient's condition. And then we're going to also talk about using the same technology but using it on the patient's own smartphone instead. So we're going to start at the top there in the left corner with the Managed Kit. These Managed Kits, as I had mentioned, is a nice prepackaged solution. It's a locked down tablet that only the pathway or the protocols that are assigned to that patient will present on that tablet. In the middle of the screen here is using the same back-end tool, but just presenting the content on the patient's own phone. And then later this summer, we're coming out with IVR, basically for be able to check the box on being able to provide coverage for all different levels of needs. Whether that patient doesn't have a smartphone but has a landline, we can still keep them connected to their care team, but use IVR as that means. All of that data, no matter what form factor that it's coming back through, is all presented into the same back-end tool that the clinical team uses to then measure and manage the health of their population. So the nice thing there is it doesn't matter if their patient's using their own smartphone or they're using the managed kit or IVR, it all houses back in the same application that the clinical team uses to take care of their patients remotely. This is just a screenshot of that kind of call center, or I like to say care center. This is where all the information comes back in, and most of our customers either have a dedicated team of nurses that are managing these patients, or they have nurses that have this as part of their roles and responsibilities with other duties. I wanted to show this slide to kind of show you how Vivify fits into ZeOmega's 5 essential pillars. And so we cover across the continuum there how we can use our platform to bring in the rich clinical pathways or protocols or care plans to present to the patient on their own device or tablet. We can capture that data, how frequently the care team needs to look at that data. The daily monitoring is part of that continual health improvement, assessing the patient's health, keeping them engaged, educating them, shaping their behaviors, and all that translates into improved outcomes. So being able to get that data, serve it back up to the Jiva product so that the clinical team can then know who needs attention. So I was looking at your agenda here, and I highlighted, I gotta get my glasses on. I highlighted this sentence here: value-based care and payment models are no longer the wave of the future. They are here and here to stay. That is so true. I have really seen a shift in the last 12 months where it's to the point where you've got to get on board or you're going to get run over as far as setting up your business to be value-based. This was a McKesson study that was done back in 2014, where at that time they showed that as of 2016, we're really moving more towards fee for value instead of fee for service. And by 2018, the pendulum has really shifted more for fee for value. So this is just highlights how important it is that organizations are setting themselves up to be ready to be positioned business-wise to provide remote care. So even if the organization isn't at that point where they're doing fee for value but fee for service, you can see through the different quadrants here where Vivify can still support their business models by providing remote care that maybe manages their readmissions or reduces their length of stays in the hospital setting because they can get them home sooner if the provider knows that they're being monitored with our technology. Patient engagement is key. I mean, unless you have a patient that is complying with the program that you've been set up for them to get their information back, if you don't get the data, you can't react to the data. There's different ways to engage the patients, as I mentioned earlier, with either the managed kit, BYOD, or IVR, and based on what level of risk, you have that ability to then assign that level of technology. So for maybe at your healthy or at-risk population, they may just be fine with doing IVR, and you have a touch point with them once a week or once every 2 weeks, or however often you need to do a touch point with them. If it's more of the rising risk, this is maybe somebody that if they have a smartphone, you would want to keep more touch with them maybe 2 or 3 times a week. I would say my husband falls into this category. He's recently diagnosed with high blood pressure, and the physician wanted to put him on blood pressure medicines, but he really wasn't wanting to take it. And I said, well, you have really 3 choices. You have do nothing, or watch your diet and exercise, or take your medicine. And so I've got him on a little program now where I'm measuring his blood pressure every day to make sure he is being compliant with taking his blood pressure and managing his diet. So, you can really see how using the patient's own smartphone can really keep them connected and concerned about their health. And at the high end is the managed kit. And this is more for your population that is maybe not so familiar with using their smartphone or doesn't have a smartphone. Higher risk, more complex chronic patients that you want to make sure you're getting that data daily. This would be your fragile diabetics, your heart failures or COPDs, those kind of patients that really need to have clinical eyes on them as they are in their home setting to keep them healthy. So with the BYOD, it's using the patient's own phone, so they're already familiar with how to use the phone, so it's pretty easy acceptance for the patient to be part of the program. Obviously this is a much lower cost solution because you're using the patient's own hardware, their own phone. You're not using the prepackaged kit. And just as you can with any of the technologies, the focus here is to keep the patient healthy, to shape their behaviors, to get them educated on how important it is to understand what your medicines are, how important it is to watch your diet, to be active, and so forth. So all of that education and can be provided no matter what the solution is here. We can brand it with the organization's own branding, white label it, so it really looks like it's coming from your organization. Have a large content library as part of our default. We also can bring in third-party content as well. We would, a nice relationship with what's already in ZeOmega can flow back and forth between the Jiva product and as well as through Vivify there. With the managed kit, it's an instant-on care plan. What do I mean by that? The tablet is a 4G connected tablet. It doesn't require healthcare workers to actually have to go into the home to set it up. The patient simply turns the tablet on, and their clinical protocol or pathways are already on the tablet ready to go. It is as simple as turning the tablet on, and the tablet immediately tells the patient what to do. And you'll see that when I demo it here. So it's an instant on. I always like to say it's like the Staples easy button. Instead of the easy button, it's just turning the tablet on and you're ready to go. The tablet becomes the virtual coach. So not only does the patient see text information, they'll see the patient, or the tablet will talk to them out loud, so we have text to speech. I like this as a nurse. I like being able to get information from the patient, but more importantly to me is to educate the patient along the way too. The more educated the patient is on their medications, their diet, their activity, their condition, typically that translates into better outcomes if they're more aware of what's going on with them and how to self-manage their condition. We have the ability to do medication reminders, and another nice feature is being able to do virtual visits with the patient. So you do an eyeball to eyeball with that patient. We have the ability to not only do one-to-one virtual visits, but one-to-many, so you can bring in others to participate in that video call or virtual visit with the patient. So you can see, for instance, maybe the adult child is 1,000 miles away. You can invite that adult child to participate in a video chat with that patient, with the provider, with the pharmacist, with the nutritionist, and so forth, and really kind of do like a little case conference if you choose to. As I mentioned, this is already, cellular connectivity is already built in, so it doesn't matter if the patient has Wi-Fi or internet in their home. We're not beholden to that. The connected tablet is what connects them back to their care team. So I'll just take you through some quick slides here, the experience the patient goes through with the tablet. So as I'd mentioned, they turn it on, it's locked down, there's no other program the patient can do on this connected tablet other than the protocol that's been assigned to them. Very visual, large icons, large buttons, text to speech. All of that data then flows to the right there into the back-end portal, which we call the caregiver portal. This is almost real-time information. The bottom, when I do the demo of the tablet, I'll talk a little bit more about the colors that you see there, but patients typically just go through, capture their biometric data. The tablet's talking to them, repeating back what their measurements are. We're capturing their blood pressure. We're asking them some questions. So I'm capturing not only qualitative data, but quantitative data as well. So basically triaging that patient. We can educate them on their condition. We can do virtual visits. And all that data then goes into the back-end portal. This slide here is just showing that there's different methods of deployment that can be used even within an organization. So some of our organizations, the patient is enrolled at bedside during an acute encounter. Some of our organizations are able to enroll that patient in the home setting through home health agencies, or you can even drop ship usually have trouble saying that, drop ship the kit to the patient's home. You know, if you want to just have the patient open up the kit and get started themselves. Now, obviously, if you're using BYOD, they would just get a text link, and they would select that text link, and they're into the program. The platform, this is the back-end tool, the clinical tool that the clinical team uses to look at this data. We have many, many years of experience of integrating data that we're getting in through our cloud-based application back into another system such as ZeOmega. So this is what the clinical team uses. So here is just a sampling of some screens. You can see track and trending the biometric data, which you see here. Whoops, the wrong pointer. Tracking, trending the data here. You can chart a note. You can see the alerts. You can do virtual visits. All of that is performed in one tool, which is used no matter what, like I said, mentioned earlier, what form factor that patient's using. As I mentioned earlier, we are content agnostic, meaning we can bring in content from other parties, and we have so. We have a partnership with American Heart Association where we have embedded the top 6 cardiovascular conditions into our product. And these are very, very nice, obviously evidence-based, scientifically proven clinical pathways. So if customers choose to use their own content, partner with another content provider, and obviously with ZeOmega, we have a very rich library of content already, but this is just a choice as well. Also, we have over 800 plus videos already part of our default platform that can educate the patient on their condition, on a procedure, on medications. These are nice because these are very short videos. They're not like 5 or 10 minutes long. They're typically anywhere from 30 seconds to a minute. So you're not bolusing that patient with a bunch of information that they probably will train this much on. So the nice thing about these videos are they're short, they're to the point, and then you can come back with some teach-back questions that are related to just what they watched to really grade, did they retain, or did they capture, or did they understand what you were trying to educate them on. This is a couple of our content providers here. Outcomes. So I'll go through 5 outcomes real quick, and then we'll do the product demo. How am I doing on time here? Okay, so the first one here is Alignment Healthcare. This is a large organization that they are kind of the middleman between a payer and the provider. Let me take a drink. And you can see here that they've had some pretty remarkable outcomes already with using our solution for over 1.5 years now. 49% reduction, oops, keep hitting the wrong thing here. 49% less admissions in 2015 than they saw in 2014. This is on the same cohort of patients that they're monitoring. 37% less ED visits in 2015 than they saw in 2014. Replacing nurse visits into the home. 30% less readmissions in 2015 than in 2014. So pretty impressive statistics here with using remote care. Intermountain Healthcare, this is a narrow network provider out in the west, mainly in the state of Utah, that they have a payer and a provider arm to their program. And they launched their program back in 2014 and have some 9x reduction in inpatient visits and a 4x reduction in ED visits. Overall patient satisfaction, 95%, which is key. You know, if you have satisfied patients, that increases your compliance and that increases good outcomes. Children's Health here in the Dallas area is a large pediatric hospital that has been using our solution in their solid organ transplant population. They are monitoring fresh liver transplants and kidney transplants that aren't fresh, but these pediatric patients were non-compliant, so they decided to put them on a remote program for 1 year long. Great results with these. Are going to be publishing those shortly here, but they were also able to demonstrate some efficiencies in how they were providing their services. So now instead of the fresh liver transplant patients coming into the children's clinics here every week, they've replaced that in-clinic visit with a virtual visit. So now what happens is the nurse practitioner, instead of going into an exam room to see a patient, she's blocked an hour or so a day where every 15 minutes she's doing a virtual visit with those remote patients. And the parents love it because they don't have to load up all the kids and everything to come into the clinic. And also some of these pediatric patients live many, many hours away from the Dallas-Fort Worth area here. So great results there as well. They just recently started doing pediatric bariatric surgery patients as well. They're going to be starting this summer on left ventricle congenital heart disease patients. So they're adding more and more use cases to their program. Memorial Hermann has been on our product for almost 3 years. They started out in home health and quickly saw the results with using remote care in the patient population that has a skilled nursing need. So they decided to open up the doors basically and cover more patients that may not necessarily have a skilled nursing need but could benefit from remote care. So now it's a corporate-wide initiative, and they've had some great results here as well, 17 to 5% on readmissions. The other impressive result is length of stay. Length of stay here has basically dropped from 82 days to 48 days, which translates into some good ROI there. And then last result here is from Christus Healthcare System. We've been with them for about 4 years now. And again, a common theme here, reduction in readmissions, some good ROIs, and patient satisfaction and compliance. So those are just some good examples of 5 of our large deployments, customers that have been using our products for many years that are really realizing good results with using remote care.